Pain Assessment and Management Across the Lifespan by Ureli Martin and Tara Springelmeyer.
Pain is whatever the patient says it is and exists whenever he says it does. Pain is a vital sign during physical assessment and a priority in the nurse's care of the patient. Our job as nurses is to believe whatever the patient is telling us about his pain and to use both prescribed medications and alternative therapies to obtain fast, safe, and effective relief of that pain. Consistent and adequate pain control over time without the emergence of breakthrough pain is a goal of nursing management of pain. Given the highly subjective and individually unique nature of pain, a comprehensive assessment of the pain experience provides the necessary foundation for optimal pain control. Pain can be a helpful warning sign that something is wrong and needs to be corrected. Pain may be a physiological warning system alerting the nurse to a problem or unmet need demanding attention, or it may be a diseased, malfunctioning segment of the nervous system.
This is a neonatal infant pain scale, and it's used from birth up to 6 weeks after birth. As you can see on the table, there's two columns. On the left side, we have the characteristic, and they each have their own score depending on the scoring criteria on the right side, and this is what we look for in the child. So this is another assessment tool for nonverbal children. This is the faces, legs, activity, cry, and consolability observational tool. And this is used for infants and young children who cannot self-report pain yet. And then as you can see on the table, we have the categories on the left side and then the scoring criteria on the right side. This is the Wong-Baker scale, and it's used for patients that can self-report pain. So it's used for children from 3 years up to adolescents. However, it can also be used for geriatric patients. So the individual selects the facial expression that best describes their level of pain. These are some tools that can be used in children that can self-report. We have the Oucher scale, which the child is presented with 6 photographs of a child with different facial expressions of increasing pain. And there's a numerical scale correlated with these facial expressions. And we ask the child to select the picture that best indicates their pain. We also have the poker chip tool, and the child is given 4 chips, and we ask the child to pick the number of chips that best compares to their pain. So 1 chip indicates the least pain, and 4 chips indicates the most pain. We also have the numerical pain scale, and this is a line with descriptive words of pain intensity and numbers. And the child selects the amount of pain that they're feeling, and it is matched up to the numbers. And then we also have the word graphic grading scale, and this is like a number line but just with words, and the child also selects the word that best describes their pain. In pain assessment for an adolescent patient, we use a combination of a human drawing, which helps the patient indicate the exact location where they're feeling the pain, a word graphics rating scale, which we have them select a word on the line that best indicates their pain, and a list of descriptive words that they can choose from that best describes their pain. So we have the Pukey RST method for adult clients. So we ask them, P, what provokes the pain, what is causing their pain, and what can make it better. Q, the quality, so what does the pain feel like, and we ask them to describe it for us. And then we ask if it radiates anywhere and where exactly is the pain located. We also ask them to rate the pain for severity on a scale from 0 to 10. And then we also ask about the onset of the pain and how long it's been occurring.
When a woman is in labor, she may have enough pain that it is difficult for her to respond to the nurse's questions about her pain or to respond to the nurse's suggestions as to how to help that pain. Also, a woman needs to get an epidural in the early stages of labor because if she waits too long and is dilated too far, it will be too late. Also, a woman who has already agreed with her partner upon a natural childbirth may not want to look weak and disappoint that partner and may not admit to the level of pain and resort to the level of analgesia that's really called for by the situation. Signs of interpartum pain include tachycardia, elevated temperature, elevated blood pressure, restless behavior, and guarding of certain areas of the body, especially the lower back where contractions originate. It is important for the nurse to go over pain control options with the mother and her partner prior to the day of delivery. An important thing to remember when assessing pain in the geriatric client is that they might not want to admit to the level of their pain because of the lifestyle changes it could mean for them. They could be afraid of becoming addicted to opiate medications or of having to live in a care facility, so they may be more hesitant to express their pain. Also, many older clients may simply view pain as a part of the aging process, and it's our responsibility as nurses to let them know that pain is not a necessary part of aging and that there are different options available to them for the treatment of their pain, including non-traditional methods. For more mature clients who may be suffering from dementia, tools such as the revised FACES pain scale and the Iowa pain thermometer are easy tools to let those clients express their level of pain. The Iowa pain thermometer allows even impaired patients to easily point out the level of pain that they're feeling. In end-of-life care, cure is no longer an option for the patient, so comfort becomes the central nursing objective. In cognitively impaired patients who can no longer express their pain, the nurses can look for signs such as grimacing, wincing, moaning, and restlessness. For older patients who are cognitively impaired, the mobilization, observation, behavior, intensity, dementia pain scale is useful, and if those patients are also nonverbal, the Abbey pain scale is useful. This is the MOBID pain scale, which can be used to assess mature cognitively impaired patients. This is the Abbey pain scale to help a nurse record the pain level of a cognitively impaired nonverbal patient.
So some of the non-pharmacological pain management methods used across the lifespan include transcutaneous electrical nerve stimulation, acupuncture, massage or vibration, cold therapy, heat therapy, and counter irritants. We also have acupressure, chiropractor adjustment, relaxation techniques, imagery, deep breathing, and hypnosis. Specifically for children, we have the distraction method, and there's different approaches to distract the child depending on the child's age. The child cannot be distracted if they're in severe pain, and it's not safe to assume that the child is no longer in pain if they are distracted. Parents can usually help with this. We also have the sucra solution method, which has an analgesic effect for 3 to 5 minutes, and it's given to infants up to 1 month of age, and it's used for painful procedures such as venipuncture. For pharmacologic pain management, we have the World Health Organization 3-step analgesic ladder. In step 1, we use non-opioids for mild pain. In step 2, we use weak opioids for moderate pain. And step 3, we use strong opioids for severe pain. And medication can be given as a single dose, as needed, or continuous. And continuous is usually given as a patient-controlled analgesia, and it's an infusion pump which allows the patient to request medication whenever they feel their pain. But the dosage and dosing intervals are programmed, and this can be given to children as young as 5 years old. Pain management for women in labor usually include regional anesthesia, which includes an epidural block, a spinal block, or a combined epidural spinal block, and then opioid analgesics, which include Statol, Mubane, or fentanyl. And it's important to always check for respiratory depression in both the mother and the newborn, and not to give it to the mother late in the first labor stage. Pain management in the end-of-life care usually starts from the simplest remedies and then up to the higher level medications, and is usually a combination of oral and parenteral medications, and opioids are most commonly used. And it is also very important to make their environment feel comfortable, such as decreasing the light, reducing the noise levels, removing any unnecessary monitors, and removing any restraints if the patient was placed on them, and then allowing family members to be present with the patient.